Rick Foster loved South Carolina. He was really concerned about the health status of every single person in the state. He was committed and dedicated his life to making sure that everybody, no matter who you were, where you lived, you had the access to care.
In almost all aspects of Rick's professional life, he's larger than life. He had a big voice, he had big ideas, he had big expectations, and he could motivate in a large, large way.
Everything he was involved in really showed his commitment to serving the underserved of South Carolina.
Oh, I think the thing that made Rick so special was his passion and his commitment to it. He didn't do a single thing that wasn't motivated by the best interests of the people of the state and the patients that we would serve.
He was a connector of people and a connector for ideas that would really elevate the work that we do in the state, and especially he was passionate around health equity.
If you looked up Dr. Foster's name in the dictionary, it would probably say equity beside it, because that's what he really believed. And he believed that telehealth was a way to improve the gap between rural and urban, and the folks that have and the folks that don't have.
You know, as soon as the thought of developing a telehealth initiative came up, Dr. Foster was on board and he wanted to be a part of it. And he was one of the drivers that really wanted to make sure it was promoted, because he saw the needs in the rural communities, and he knew that they're using the telehealth, that it could improve the outcomes for patients who lived in rural communities.
He inspired me by always thinking about other people and always trying to figure out ways to connect resources to people and programs to people and programs to programs, and always intertwined everything, and it all made perfect sense because it was all for the benefit and well-being of the patient.
The day I hired Rick was the first day and the last day that I thought he worked for me. I learned quickly that I worked for him because he was working for our patients. He was committed to making sure that every single person in the state got the right care, and that's what inspired his work and what inspired other people to follow him and work with him, is the fact that that singular focus on patients.
You know, he was so clear on what he wanted us to achieve and who was important. It wasn't about him, it was never about Rick, and it was never about me, and it was never about any healthcare leader. It was about those that we're called to serve. And you never miss that in a conversation with Rick. He didn't throw it out in front of you, he didn't make you feel bad about it, but he was a constant reminder that we're here for a larger purpose, and I will always love Rick for that.
He certainly is someone that I would consider a mentor. He had a love for life and a love for people.
Rick was such a family person, and I want his family to know that even in the midst of all the things that he did, his family was also a part of that. You know, he was a guy that loved family, loved Clemson football, an all-around guy that even though he had great passions, he also, I felt like, understood how to have balance as well.